Bruce Marshall, thank you for joining me for this Maersk Industry Forecast, where we're going to talk about pharma and healthcare. And let me start off by asking, how has the pharma and healthcare industry been affected by the disruptions we've seen over the last plus 2 years now?
So the pharma and healthcare industry has been quite drastically impacted. And we've seen a bit of a change in the way that our customers are starting to engage with us. One of their key needs is about this consistency to deliver quality of their goods to their consumers, often life-saving goods. So they've become much more clear on making sure that they're closer to the asset owner, or the people who have direct control of the outcome of their goods or outcome of the services they need. What we've seen is probably one of the key metrics or key dynamics in the most recent 2-3 years. It's not a new phenomenon in the pharma space, but it's something that's definitely been accelerated.
So Bruce, with us today also you have brought Risto Petkov, who is the head of pharma here at Maersk, and thank you for coming here as well, Risto. Are there any groups within the pharma and healthcare industry that has been hit harder by the disruptions and congestions we have seen than others?
Basically, they want peace of mind. So when we talk about some of the products disrupted from the latest disruptions in the world, definitely, first of all, the PPE equipment, that was the hot topic 2-3 years ago. And of course, there is also separate ingredients missing, contract manufacturers losing their capabilities to produce formulations, or not having the quality capabilities because of shortage of people. So yes, there has been quite some disruptions.
Everyone knows it can be life-saving to get the right medicine at the right time. How critical has this been? I mean, this disruption for the pharma and healthcare industry in particular.
It is very critical. I mean, delivering a product to a patient could be a matter of life and death. Just imagine if we're waiting for a specific product and we don't get it.
You know, Chris, before COVID started, before supply chains became so heavily disrupted, we could see the pharma customers trying to move more to the ocean space for a couple of reasons. One, sustainability. Two, quality. In a container, once it's sealed, it's much easier to keep the temperature settings, and hence less variation in the temperature that the medicine is exposed to, right? And the third thing, there's a cost aspect as well. Prior COVID, you saw this switch, or this ability, or wanting to switch, but they've got a purpose that they need to deliver their commodities or their medicines to customers, so they've had to switch back to an air freight mode because of the speed requirement. Getting stuck on a ship in the middle of the ocean, or even just in a port, it's still too far from the consumer to use. So the only way to change that was to go air freight. I think against a lot of the industry's will or want, but what's most critical is meeting the customer outcome, making sure that the consumer has the medicine when they need it, where they need it.
So digging more into that, Risto, how has this affected the pharma industry's cold chain logistics?
When you look at the pharma and healthcare industry, they're of course looking for very strong partners who can offer them resilient supply chains. As Bruce spoke, I mean, they're looking into ocean freight, air freight, overland transport, no matter the mode of transport, just getting the product to the final patient. They're looking for global partners who have the assets, they have the product capabilities, the solutions are ready and at market, and also a global suppliers who are really getting closer to those global suppliers who can really deliver this.
But these problems that we're talking about, they're global. They're all around the globe, and they go across all industries. So, I mean, is there any way around this?
The reality is right now we struggle to meet all of our customers' requirements. And it's not just Maersk, it's an industry thing. There's a lot of challenges, from congestion to port issues to COVID lockdowns. All of these things make us meeting these time-critical deliveries more and more difficult to do. So in a very simple answer, can anybody deliver it right now? No. I think it's about trying to partner with the best logistics providers who get closest to that end goal that meets your requirements to deliver to your consumers or your customers. I think that's where we are.
Maybe if you think about 40% of the products that the pharma and healthcare industry produce move by cold chain, and very little currently actually moves by cold chain. So the needs are there, but the capabilities are still missing. So there is actually a lot of room for improvement.
And finally, Christo, I'd like you to give us one final comment on, how can companies in the pharma healthcare space, how can they prepare for the coming months?
I think the pharma and healthcare industry are doing the right things. They're getting closer to their logistics service suppliers. They're getting better transparency, they're getting better control. If not through their supplier, they're developing it internally. They're getting better digital solutions. They're consistently looking for innovation, and they're trying to be able to make quicker decisions overall. So a lot is happening already. So yeah, I think they need to keep pushing.
Christo and Bruce, thank you so much for joining me today.
Thank you, Chris. Thank you.
Thanks for having us.